So hi, hello. So I am Sridharan, Assistant Professor from the SNS College of Physiotherapy. So in this video, we're going to see about the topic which comes under the pediatrics. So in pediatrics, we're going to see about the topic which is nothing but the growth and development of the child. So what is growth and what is development? So generally there is an specific differentiation between the growth and also the development. So first we're going to see about what is growth. So growth represents the increase in size and mass of the tissues. So generally, so the growth is nothing but the increase in size and also the mass of the tissues, which is measured by the physical maturation, and it is a quantitative representation. So in what is development? So development denotes nothing but the acquisition of the variety of skills for the optimal functioning of the individual, and it is a functional maturation of the child. If the structural and physical maturation, it is called as the growth, and the functional and acquisition of the skills, it is called as the development. So next one is factors affecting the growth. So what are the factors that affecting the growth are? So generally there are 4 different types of factors which is affecting the growth. So they are genetical factors, environmental factors, social factors, and endocrine factors. So in first one, see, genetic factors is nothing but the phenotype, the transmission of the parental traits to the offsprings. And next it comes under the races. So the comparing the races of the worldwide population, the growth potential of the children from various racial groups on the different. And then sex. So sex, it is nothing but the gender. So in this condition, the boys are generally growing taller and heavier while comparing to the girls at the time of the birth. Then next one, it is an genetical disorders. So Turner syndrome and Down syndrome, these are the some of the syndromes which genetically affects the growth of the child. Next one is environmental factors. So what are the environmental factors that affecting the growths are? So first one is prenatal period. So during prenatal period, if the maternal nutrition is above minimal level, or mother is affected by the anemia, or else the mother is taking intake of tobacco and alcohol, it can lead to the small sized fetus. And multiple pregnancies, medical illness, and maternal infections and drugs, these are the things which affects the growing factors of the child. Then next one is during postnatal period. So if suppose the baby affected to the neonatal hypoxia or else convulsions, these can cause the brain damage and the persistent and the recurrent diarrhea and respiratory tract infections. So these are the factors that affects during the postnatal period. So third one is social factors. So in the social factors, the socio-economical level plays major role in affecting the child's growth rate. So children family with high economic status are prone to develop overweight and obesity. Then next one is poverty. So if a child's family is affected by the poverty, they can lead to the hunger, undernutrition, and infections. These are closely associated with the poverty, which decreases the rate of growth in the child. And next one is climate. So growth rate is higher in the spring season and as well as lower during the summer season of the months. And the emotional factors such as if the children with broken homes and orphans do not grow and develop at the optimal rate of level. So, and the anxiety, insecurity, lack of emotional support from the family can affect the neurochemical regulations of the hormones, which can reduces the growth rate of the children. So next one is endocrinal factors. So endocrinal factors are following hormones are necessary for the growth and development. So these are the hormones which helps in the children's growth rate. So they are growth hormone, thyroxine, androgens, and insulins. So now we are going to see about the factors affecting the development. So these are the factors that are affecting the development of the children. So they are prenatal factors, neonatal risk factors, post-neonatal risk factors, and the social factors. Next. So in the prenatal factors, so intelligent quotients of the patient's parents' IQ level, parental attitudes involvement, and the genetical factors, chromosomal abnormalities, maternal factors, maternal drugs, hypothyroidism, stress. These are the factors that affecting in the prenatal period. And the neonatal during the neonatal stages, the low birth weight, growth retardation, and premature babies and hypoxia. And during the neonatal seizures such as it leads to the malformation of the brain and the intracranial bleeding. So thank you.